Hey, everybody, and welcome to this episode of the Pelvic Perspective Podcast. I am your host, Dr. Joanne Michelle Martin, specializing in everything between the belly button and the knees. And one of the amazing things about, hosting a podcast is you get to talk to some brilliant and phenomenal human beings. And our guest today is, well, phenomenal is an understatement. And she's my friend, y'all. I just surround myself with people. It's my friends. So without further ado, I would love the world to meet the amazing Marilisse Mars. Hi, beautiful.
Hi, thanks. Thanks for having me on.
Absolutely. Absolutely. Tell us a little bit about you. Let everybody know who you are, what you do, all the things.
Oh boy. Um, so I am a therapist. I specialize in trauma and sex therapy as well. I do lots and lots of things though. So I see all kinds of clients. Traditionally, I have seen clients who are in the LGBT community. I have seen clients who are couples who are looking to improve their intimacy and who have alternative kinds of marriages. I have seen, I've seen lots of trauma clients and clients who are survivors of sexual assault. And then I think what really pertains to what we're going to be speaking about tonight is I have seen clients who have a lot of chronic pain and injuries, chronic illnesses, disabilities, things like that. So take it away.
And I love nerding out on all things all things. So without further ado, we're going to get into talking about pain. And one of the things that we've had this conversation before. One of the things about pain is as much as it is physical, it resonates up here, right? Because when we think about how pain is processed in the body, like it is processed in the brain. So talk to me a little bit about how you navigate working with clients who are dealing with pain, just pain in general, but then we can get into some specifics about maybe even pelvic pain, sexual pain, those kind of things. The fun clients.
Right. So there are two ways that I work with clients with pain. The first is a methodology that we use called brain spotting. So brain spotting, probably not the best word for it, I'm gonna be honest. It's a word that sort of makes you go like, what is what? But if anybody knows anything about EMDR, because that's one that people tend to know a little bit more about, it's sort of a sister therapy to EMDR. So what we say about brain spotting is where you look affects how you feel. So I think I'll try to explain it this way. Okay, so imagine that there is a bear in the room. Okay, so you are maybe at a a chalet, let's say, because we all have chalets to go to, right?
So standard here in Georgia.
And you walk in from, actually, it's kind of funny because I'm going to talk a little about Lindsey Vonn later. So you walk in, you're Lindsey Vonn, and you walk in off of the ski slopes, right, into your chalet, and there is literally a bear in the room. Okay. So what happens? You see the bear, you smell the bear, doesn't smell real great. You hear the bear. Preferably you don't taste or touch the bear, right? And so as a result of perceiving the bear with your senses, you have a response to the bear. And it's probably going to be like anger or fear, okay? Those are probably going to be the most prominent ones. And so what happens is when you feel anger or fear, there's a response that happens in our midbrain. So we're talking like amygdala, hippocampus, that sort of area in there. And that response turns on our limbic system. Our limbic system, okay, that's like fight, flight, freeze, fawn, or flirt, okay? So what does that look like? Okay, so fight is fight, right? I actually did have somebody one time tell me he literally fought the bear, which I was like, wow, that's brave. Flight is run away, right? Freeze is hide under the furniture, okay? Fawn is feed the bear, try to please the bear, right? Flirt is play with the bear. Okay.
That's bravery right there.
Right. We don't want to do that. Like, let's not try that. Don't try this at home, kids.
Just for all of you, please don't flirt with the bear. Please don't.
Don't try this at home. Please don't try it at home. So those all kick in, right? Or one of them, preferably. So whatever that looks like is what happens. Okay. So when the trauma is over, when the trauma ends, then our cognitive mind says trauma's over. Oof, thank God that's over, right? Problem is the midbrain doesn't exactly know that. So time is actually a cognitive construct. So the idea of time, the understanding of time actually exists up here in our prefrontal cortex, like where we have executive functioning and thought and language, all of those things, it's all up here. But all of what I'm talking about happens like back here, right? So our midbrain doesn't know that the trauma has ended. So our midbrain kind of keeps on going and our limbic system keeps on going. So the limbic system, when all of those responses, when one of them kicks in, that means that we start having the racing heart. So it's pumping all the blood to our extremities so we can fight or we can run. It means that we are losing our breath. It means our eyes are dilating so we can take in more, light, we can see better. All of those things are what starts happening. It's the adrenaline. It's, all of that is what we're talking about here. Okay, so trauma has ended. Midbrain doesn't know that. Okay, so midbrain still thinks, oh, we're in danger. And it stays in that danger place. Okay, so that's what we're talking about when we talk about PTSD. PTSD, in the classic sense of the term, is pretty extreme, so we think. However, there are a lot of different ways that can show up. So it can show up like we tend to think of like combat veterans. Mm-hmm. Okay, that's what everybody tends to associate PTSD with. It can also show up with all manner of small t traumas, which are complex, that tend to sort of layer on top of each other, like a kid who gets bullied at school, for instance. One day it might not be the biggest trauma, second day might not be the biggest trauma, but you put that stuff on top of each other for a long time, that becomes a big trauma, right? And so what happens is that limbic system is now dialed way up on the scale, 0 to 10, let's say. It's dialed up, dialed up, dialed up. And once it's been happening for a long time, that poor kid's brain is like, I'm waiting for the next time this is going to happen. It's going to happen again. So there's that waiting for the other shoe to drop. It's hypervigilance, we call it, right? And so what do we do with that? How do we stop that from happening? How do we tell the midbrain that trauma is done? You can relax now. Trauma is done. You're safe. It's not going to happen anymore. That has been the question, the $1 million question, probably $1 billion at this point, in all of psychotherapy for a very long time. So brain spotting, what brain spotting does is it goes back to the midbrain and says, okay, trauma's over. How does it do that? So if we remember, we see the bear, we have all of the senses are what kicked off that whole process. So what are we going to do? We're going to go through the senses in order to turn it off. So where you look affects how you feel. Because what we're going to do is we're going to find a spot in the visual field that corresponds with what is physically happening in our bodies when we think about that trauma. And we're going to start to dial it back down. So we do that enough times. Doesn't usually take too many times either. We do that enough times, and eventually, we can think about that trauma, and it's just like another memory. It's not a good memory. It's never going to be a good memory, but it's like any other memory. You think about it like you think about, driving home from the grocery store. Won't like it, but it's not going to cause all of that somatic response and the tears every single time. Does this make sense?
I love this because in our world, right, dealing with chronic pain, which chronic pain might look like orthopedic injuries, I'm thinking of my patients with back pain, with persistent hip pain, the back pain that just never goes away. So they live with it. And then eventually they're, on medication, and then they can't come off of that. Or they've got a doctor telling them you need to have surgery. I'm thinking about this with all my clients with vaginismus and vulvodynia, and I'm very much reminded of the book, The Body Keeps Score, because it's like your body continues to register all of this. And, they look well on the outside, or persons with chronic diseases, endometriosis, lupus, things like that. They look great on the outside, and everybody's like, well, there's nothing wrong with you, which is usually what they hear from the medical system. Well, you look fine.
Yep.
We did all these tests. We did MRI. We did all these things. Everything looks fine, right? So if you're a patient, and you've heard this before, you've dealt with this before, you get it, right? And so they tell you you're fine because the MRI looks good, the X-ray looks good, the CT scan looks good, the ultrasound looks good. They can't see anything. The devices don't pick up anything, but that there is an apprehension and anxiety and a fear. And that's the other thing too, because now beyond the pain, we've now got this built up of anxiety. We've got this built up of, and it impacts more than just the physical.
Yes. And the residual impact too on the relationships and on the life and everything that's going on around them. By the way, did you see my nice little tease here? I had to give you a little tease with Georgia.
Go Dogs. For all of you non-SBC people. Yeah.
I'm giving you my little tease.
Still continue to support the podcast, but just understand where we stand, right? Like this is dog nation right here.
I couldn't help it. Red and black. Yeah. Couldn't help it. So that's exactly right. I mean, it's, anytime that there's pain anywhere, it's going to be associated. So Dr. David Grand, who developed this process, who developed this technique, who is my mentor, and I listen a lot to the things he says, because it's amazing how he can say like this huge, profound thing that it'll take me an hour to explain in like one sentence, right? So one of the things that he says is what's in the brain is in the body, and what's in the body is in the brain. And it makes so much sense to me, because like I'm so sick and tired of hearing doctors say it's all in your head, And I say that with a lot of love and respect for doctors. So don't get me wrong. Obviously they serve a very important purpose. I have to say that, and that tends to be a response that people get when doctors don't know what else to say, when they don't have a diagnosis available to them to give a patient. Then the response is, well, if I don't know what it is, then it must be in your head.
Mm-hmm.
And it's like, well, just because you don't know what it is doesn't mean that there's not something there. I say that with love, Yeah. So, and it doesn't really make sense then when you think about it anyway, because it's not like these two aren't attached. So yeah, what's in the brain is in the body, and what's in the body is in the brain. So yeah. So all that to say, what's really interesting to me about it is that a lot of my clients will say when we do brain spotting that it is sort of, it feels like what our brain is supposed to do when we just get out of its way. And I'm fascinated by that, because I sort of think of it like our brains know what to do to heal our bodies. They know what they're supposed to do. And so that makes sense to me. Like we just kind of get out of the way and let our brains do their thing. We just kind of give it a little nudge.
Just give it a nudge. Well, I'm also intrigued by this, because then you think of the applications, right? Not only chronic pain, but something that you alluded to before, Lindsey Vonn. If you don't know who Lindsey is a world-class Olympic level skier, does just things that the rest of us could only dream of doing on a slope. Really, I'm still on the bunny slopes, y'all.
I've never even put on a pair of skis.
Give me some time. Cross country skiing only. I will not do downhill. My constitution is not that strong, but I digress. But now you think about trauma, because people think about trauma in terms of pain. People think about trauma as in, I hurt, this this is it. Or something major, like you mentioned, like military veterans, right? Like I was in this explosion. But what about trauma being an unexpected result, an unexpected response?
Mm-hmm.
What about that? And then, like, in terms of like athletes, for example, like how does that manifest?
So the way that I sort of talk about trauma in terms of identifying it is that it's any moment where the rug has been really pulled out from under us. Trauma has become such a buzzword these days, and it's difficult to nail down because it's kind of one of those words that's sort of beginning to lose its meaning because it's used so much. So I talk to my clients a lot about what does it actually mean. So I think it's easier to define really when we talk about it in terms of how people experience it rather than we talk about like, okay, these are the diagnostic criteria. And if you fill these diagnostic criteria, then you have experienced a trauma, what else? So it's really a moment when the rug has been pulled out from under us all of a sudden, unexpectedly, in quite a negative way. And when we sort of define our lives in the before and after sense following that. And I mean, you do have the criteria of like, yeah, you can't stop thinking about it. You have nightmares, you have flashbacks. Flashbacks, interestingly, and this is one of the reasons why brain spotting is so effective. Flashbacks are not memories. People think that they're memories. They're not memories. They're actually re-experiencing. Our brain actually thinks that we're there. It's a midbrain experience. So the midbrain stores memories differently than where we usually store memories. Neocortical, not subcortical. Subcortically, when we store a memory in midbrain, we store it as a somatic experience rather than a thought. So we store that memory as a sound or a smell, a sight, an image, a feeling in our bodies, which is why people have deja vu,
Deja
for
vu.
instance.
I was going to ask. And is that the reason why they say the power of smell or scent is such a strong sense, because it can throw you back into.
Yeah, absolutely.
Awesome.
And so when we're talking about athletes, you're exactly right. So when we talk about athletes, an athlete, experiences an injury during a game, or they experience like what we would call a sports humiliation. So that might be missing a game-winning kick. If you're the kicker of a football team.
Go Dogs.
Right. Any opportunity I can find. Go Dogs. Go Dogs, go Falcons, Atlanta United. Those are my teams. So anytime there's some sort of a humiliation like that, that is absolutely a trauma. I mean, imagine yourself, in a stadium with 95,000 people, not to mention the entire world press, like watching you if you're in the Super Bowl, let's say, Falcons, and something happens, like you lose a 25-point lead, and then you lose the whole game. That entire team has now experienced a sports humiliation trauma, one that's going to plague them for how many?
It's been a while.
It's been a while. So that is a major trauma. It's a moment when the rug was pulled out from under them because there they were 25 points ahead and they thought they were going to win, right? And then all of a sudden
so did we.
Right? Didn't we all? And so then all of a sudden they found themselves not winning. And it was like, wait, what? And they couldn't seem to stop it. And every moment that something was happening that was moving them further and further away from the win was another trauma. And it was becoming more and more complex because it was like, oh my God, it was getting worse and worse and worse and worse. So every time something happened, their midbrain was dialing up more and more and more and more. And when that's happening, that's preventing a peak performance for them. When our midbrain is on, our limbic system is on, then there's not going to be an opportunity for peak for performance there. So we use brain spotting a lot for performance anxiety. Dial down that limbic system, you have better performance because you have relaxation. Your muscles are going to do what you want them to do. You can think better, all of that, everything. So back to the Falcons. So every moment that went on was a further trauma. And so once it was all over, then of course it was before the Super Bowl and after the Super Bowl, right? So all of this constitutes a huge trauma. And if you look at the players that were in that game for the Falcons and you follow them, and if you follow the Falcons as an institution, now we have institutional trauma too, which is a whole different thing. So had we been able to intervene there and do some brain spotting, pet theory, but there are a lot of NFL teams that actually use brain spotting. It was the Titans that I was thinking about earlier. The Titans, I was trying to remember this earlier. It was the Titans who actually recently implemented brain spotting for their team. Then we would have seen a resolution of that trauma and a repair. And we more than likely would have seen an improvement in all of those players with the Falcons.
It almost makes me think that we need to have like, when we think about sports teams, right? And we think about who's there. Like we have the coaches, we have the team, obviously. We have the athletic trainer, you might have a physio like on hand as well. But we might need a mental health therapist down there, like, because, you think of being in the midst of it, like a coach, like I coach volleyball, right? Like I coach youth sports. If I've got a kid and we're, as a coach, you're kind of trying to reach them the best that you can, you realize that they're digging themselves out, into a hole. Sometimes the best thing you can do is pull them off and try to see if they can like regroup before you put them back in again. But what if you do that and there's no regroup, like there's no coming back? And
right.
That's if it's one player. But now what if it's the whole team?
Right.
Because it happens.
So,
like it can happen. Like there's some days that their bodies show up and it's like their spirit was left in the bed or the hotel or wherever it was. But all we got is bodies on a field, on a court. And it's like, where are they?
I'm so glad you just said that, actually, when you said that about their spirit not being there. That's one of the things that I think actually often too causes further trauma for people who have had sports humiliations like this, is that a lot of times there's a perception, especially when you're talking about professional teams that are in the press. Mm-hmm. The Falcons have taken just a heck of a beating in Atlanta. Hometown, we love them, but man, we're also real hard on them. They have taken quite a beating for how they lost that game and what has happened since. And a lot of the beating that they have taken has been like, where are y'all? Don't you care? You're not showing up with any spirit. And it's like, it's so hard on them because it only increases that humiliation. It only makes that worse because they're saying to themselves, but I am here. Like my spirit is here. Spirit is willing, flesh is weak. I am here. I'm showing up. I'm trying as hard as I possibly can. And my body just won't do what I want it to do. There's a name for that. There's actually a name for it. It's called the yips. So some people will remember that name. It's been around actually since like the 1920s. But there was a guy, I have to think of his name. What was his name? I had it earlier. Mackie Sasser, I think was his name. Mackie Sasser. He was a baseball player. Long time ago, trying to remember which team. He was really, really famous guy who lost his entire career because he developed the yips after an injury and could not play. Just it ended his career. And he was one of the most talented pitchers. He was pitcher, catcher, pitcher. Oh, I'm bad.
I'm not a baseball fan. Sorry, Braves.
I mean, I love the Braves, but yeah. He was one of the most talented athletes like to ever hit baseball and just ended his career so fast. So David Grand got hold of him a few years ago. I guess it's probably been 10, 15 years ago now. I'm getting old. um, my years are running together. And there was an ESPN episode of that their show 30 for 30
Mhm.
about it, and David Grand got hold of him for like a couple of sessions, maybe. I can't remember how many he did, 1, 2, 3, something like that. And the yips were gone. Gone. Can you imagine, for this man who had lost his entire career, and he was like, couple of sessions and I'm back out on the field?
I
Like,
mean, what does that make like some of those people who might even hear this and their career has been over and they're like, you're trying to tell me that this could have helped
yeah,
and
there are a
nobody told
lot
me?
of them. There are a lot of them. So Esquire just did an article fairly recently. I feel like it was in December or something of last year, um, about the football player. Oh God, Magnuson. God, I am not doing well with names tonight. I am terrible. Um, and that this is coming from a football fan too, who just left the NFL. Also, like a really, really talented football player, kicker, um, and because he had the yips, and hooked up with a guy named Armando Gonzalez, who is a sports psychologist and is a brain spotter. And Dr. Mondo is what he's popularly known as. He was Lindsey Vohn's psychologist, and he just has worked wonders with a lot of athletes.
Mhm.
And he was one of them. And again, left his career, left the NFL, and then did this work with Mondo and like turned it around. But he's already out of his career. So one of the things that this article said was that a lot of athletes have had that experience. They leave their careers and then they do brain spotting, and then they're looking at, okay, like, what am I going to do now for my secondary career? And a
Yeah.
lot of them, what they end up doing is like development. They end up like coaching and developing athletes and helping them get through what they have experienced. So one of the things that you said earlier was like, we need like mental health therapists, doing this? And the answer to that is yes. So most teams have sports psychologists who work for the teams, and they practice some sort of CBT, usually cognitive behavioral therapy. And it, a lot of times you hear things like mental toughness. That's one that's been really popular in sports for a long, long time. Kind of starting to get away from that, getting a little bit more EMDR in the mix here and there. I prefer brain spotting. It's a little bit more organic. It's a little bit more user friendly. It tends to get a little bit deeper into what's happening, and tends to be better for athletes because it is more somatically involved. So it works better for them as a methodology, and it helps their bodies more. So we are seeing a little bit of change on that front. We don't see a lot of sports psychologists and sports, therapists using brain spotting yet. So there are a few in some cities.
And what
I
about
would
like
love to see.
what about more acutely though? Like, I mean, even like court side, field side, like that type of
This
stuff.
is
I mean,
That's exactly what I was about to say. Is one of the things that you don't see that I would love to see is more therapists who will do it on a concierge sort of style, which is what I'm wanting to do and doing, wherein they take a few cases at a time, and they do intensive therapy with them, and then go to the games, so that when something happens, they're there for them when they're needed. Because one of the things with brain spotting that we do that there isn't like another form of therapy that I'm really aware of. I can think of one that sort of does it, is that this is a real mindful meditative form of therapy. So we don't just process the trauma, we're also turning down the limbic system. We're dialing it down. So we're calming the body. So if a player goes out on a field who has been injured, who has had the yips, and let's say has had 2-3 sessions, has been doing better, it's been great, they're going well, and then they get out there and something happens. And they get all freaked out and they get all like frozen and they're like, oh God, it's happening again. It's happening again. And they come off the field. And now what happens? Now they're like, I'm not going to be able to do it. I can't do it. I can't do it. And so who's there for them? Like the coach is there, and whoever is there on the sidelines, great. But if there's a sports psychologist who happens to be there on the sidelines, they've got an entire team of people to handle,
Mhm.
I mean, if this is your, starting quarterback, then of course they're going to be right there for your starting quarterback. But if it's not, if you're talking about, I don't know, one of your O-line that's, not necessarily your star player or whatever.
Your second string people, yeah.
Right. Like that's not going to be a thing for them. But if you've got a therapist that's been doing therapy with this person, and this person has been investing themselves into this work and has been doing it long term, and that therapist comes specifically for them, they go out there, they have this little like, oh, moment because something happens and it was really close and it scared them. They come off the field. That therapist says, okay, let's take a minute. We only need 5 minutes. We're going to go over here. We're going to find a little quiet space. Maybe we can go to the locker room. If we have a few minutes, we can go back to the locker room. We're cool. We're going to find a quiet space. We're going to sit down and we're going to get you centered. We're going to find an eye spot and we're going to do a calming exercise. We're going to do a body scan because a body scan specifically connects. It's not like a guided meditation where our minds are off sort of imagining, which is not connecting to the body. We're going to actually do a body scan, which connects brain and body. And we're going to use that specifically to calm every part of your body, every single part. Anytime I have somebody who's an insomniac, I do this with them. And I say, okay, I want you to learn how to do this. We're going to do it a few times over a few sessions. You're going to learn how to do it before you go to bed. And inevitably they come back and they're like, oh, I was asleep after. I didn't even get up to my waist and I was asleep. I'm like, no, you can't fall asleep. You got to do the whole thing and then go to sleep. I promise. They never can. They always fall asleep beforehand, which is okay. But I want their whole limbic system calm, So it's amazing how when you're doing a body scan, if you skip anything, even like ears, their ears will hold their anxiety.
Mm-hmm.
Incredible.
It's just so fascinating to me. And as you're talking about this too, I'm thinking about my population. I'm thinking, you said performance anxiety and I go, oh, erectile dysfunction,
that too.
Yeah. But a lot of the times, right? Like people think that ED is something like, oh, there's something physiologically wrong. And a lot of times there's not.
No. And so let me take a pause real quick too, before we talk about that and say, I also do this a lot with creative performers too. So performers who are musicians, actors, any kind of creatives too. I've worked with a lot of them. And it's a huge help. And I always have, it only ever comes from the creatives. I have creatives come to me and they're like, but my trauma is my inspiration. And I'm like, that's okay. Your trauma can still be your inspiration, but you're going to have a lot, clearer path to your trauma in terms of it being your inspiration. You're not going to have the blockage that's keeping you from being able to actually create.
Mm-hmm.
Writer's block is one of those things. For instance, writer's block is just your limbic system being overactive. Come, we will clear your limbic system. We'll get it toned down and your writer's block will be gone. I promise. I'm the daughter of an author. 2 published authors. I promise. It's amazing. I've done it with my parents. Yeah.
They got anything new coming out?
They do. They actually do have something new coming out. And that's why we did it. They just finished their first draft of the next book that's coming out. So it's in editions with an E, and they will be finishing it and then they'll be getting it out here. So when it comes to erectile dysfunction, any kind of sexual performance, a lot of times what I see happening is that it's like a snowball. starts at the top of the hill, rolls down, and it gets bigger and bigger and bigger as they go. So it's like something may have happened at some point and everybody got a little bit nervous about it, happened again because they were nervous about it, and then it got worse. And so that made everything worse. Everybody's anxiety got a lot worse after that, and then it made everything a lot worse after that, and it just kind of gets bigger and bigger and bigger.
Spiraling.
And by the time they get to my office, sometimes they're even fighting, about it. And they're fighting. Somebody's lost their desire altogether. Somebody else is like avoiding sex altogether. There's some perfectionism a lot of times that comes into play. I do a lot of work with perfectionists. Like there's all of these other things now have come into play when it started off with really sometimes somebody just had a little too much to drink one night, or somebody sometimes just was really tired or was on some medications, or something like that that initially might have been really simple. Now there are always exceptions to that, where there are cases that we have to really peel apart the etiology of it. We have to really look at like, okay, where did this come from? There might be a diagnosis behind that medically needs to be looked at. But a lot of times it just comes from this small place that really snowballed on us. And so we do some brain spotting with the anxiety there. And, a few weeks later, we're like, how was your week?
Wow.
So.
Yeah. I mean, I just marvel at how amazing of a tool this is for so many different things. Like I said, whether we're talking athletes, whether we're talking sports performance, we're talking creatives, we're talking stage performers, we're talking, a lot of the people I see with pain, who are, they don't want to have sex. They can't have sex because of the pain, because most people don't recognize pain or chronic pain specifically as a trauma. And just even thinking about, like you mentioned, for those athletes, they end up losing their livelihood. Then even if we're not talking about athletes and we're talking about the average person, when they're dealing with things like this, it impacts them in so many ways, socially, financially, relationships, all the things. And it can be such a beast. So to know that there are tools out there for individuals, especially if they might have tried something before and it didn't work, like, listen, this is something that you can definitely try, and it can be helpful for you. Now, does this work virtually as well as in person?
Oh, absolutely. Yeah,
Fantastic.
absolutely. Especially the way that I do it. I mean, brain spotters, we all practice a little bit differently. There are a lot of different ways to do brain spotting. And the way that I do it is, I'm trying to think of how to put this. I've developed sort of my own way of doing it specifically so that it can be done well virtually. And it's organic in the way that we start the process. So the other thing that I do is EFT, emotionally focused therapy. And these two things tend to go really well together. So sometimes we'll be working in sort of an EFT mode. Emotionally focused therapy is very much about the relationship between the therapist and the client. It is with brain spotting too, but in this specific case, it's very much about what's happening in a moment between the therapist and the client individually, or in a couple between the two people. And a lot of times I'll catch on to something that's happening there, like some trauma that has come up that we haven't seen before. And I'll notice that they're looking in a specific place a lot. It's like you ask somebody, you say something like I'm doing now, actually, I'm doing it. You say something like, gosh, I haven't heard you talk about this. Can you tell me a little bit more about that? And they'll go, well, it was this one time. And they kind of search around a little bit and they're like, yeah, I was driving down Peachtree and all of a sudden their eyes lock onto one spot. And they start talking about this, incident that happened. They had a car accident. And I'm watching their eyes just lock onto that spot. And the experience of brain spotting is sort of like when you're staring off into space or staring at a wall, and you start like ruminating about something, or you start, you're just like staring at a wall. It's like that, but it feels like it's kind of on steroids, because it's the same mechanism of the brain. We're just harnessing it and using it intentionally and in very specific ways. So I'll see that happen and I'll go, okay, hold your eyes right there. Like, don't move your eyes. And then we'll start working with brain spotting. And sometimes I'll put them together and it's wild.
Wow.
And it gets fun. So yeah, it's incredible, like what a huge difference it can make, and what a difference it can make even in one session when we're talking about brain spotting. EFT is a little bit different. I work with EFT a little differently when we're talking about trauma, when we're talking about athletes. And I think with athletes too, and performers, it's just as important. And it's important from a different perspective. Not just with their relationships, because EFT is typically known for being used in relationships. But it's also important, I think, in an individual milieu, for lack of a better word, because it has to do with attachment. Emotionally focused therapy is based in attachment. And what we know about attachment is that the sort of purpose, if you will, of attachment when we're children is to help us form our identities. And so when we experience a trauma breaks attachment. It just profoundly shreds it. And it's attachment with the world, with whoever broke the attachment or inflicted the trauma to begin with, the rest of the world, because we're like hyper vigilant, we're waiting for the next bad thing to happen, and with ourselves, because we always have those feelings of shame. And because after a trauma, we're going, well, who am I now? Like, I let myself get into that situation, or I shouldn't have made that left turn, or I, whatever, fill in the blank. We always come up with some kind of narrative way to blame ourselves for a trauma, which is inaccurate. But we start questioning who we are. And so the way to resolve that then is to repair that attachment and let that identity rebuild. When we're talking about athletes and performers, huge pieces of their identities are usually wrapped up in whatever it is that they're doing. Mm-hmm. Yeah. So when you talk about somebody who is a skier, an Olympic level skier, the quarterback of the football team that lost the Super Bowl by 25 points. Now, Matt Ryan's a really cool guy and is way grounded. So just to say that, I'm not going to imply that about him. And I really don't know anything about Lindsey Vonn. But as examples, when you have athletes who are really, really into whatever sport it is they play, and that becomes part of their identity, and then they end up having to leave their careers because of an injury or sports humiliation, and having had the yips and leaving their careers, what happens? If they're still in their careers and they've had a humiliation or an injury and now they have the yips, how do we bring them back to it? A big piece of that is by repairing that attachment and helping them realize that their identity is a lot more than their role as an athlete. And being an athlete, being a performer, that's a role, not the same as who they are. Feels very much the same, because it's what they've dedicated their lives to. Still a role. And CBT, cognitive behavioral, you're going to sit in front of an athlete or a performer and tell them that, and they're going to sit there and look at you like you've lost your mind.
That's a lot of college students too. They come out of college, right? Maybe they don't go pro, but they've been playing this sport since they were in little league, youth travel ball, AAUs, whatever have you. And they go to school, 4 years of college, and then they're done.
Yeah. And it's
And
like
it's like,
that.
what do I do? And I mean, granted, they
Yeah.
have whole degrees, right? Like they've got a whole degree, they can do something, but so much of who they are is wrapped up in what they do.
Yeah.
And it's
Yeah.
like, well, what do I do now?
Right. So what we have to do then is, for me, the way I look at it is we bring in a combination of both EFT and brain spotting. So EFT helps us repair that attachment to ourselves and allows us to view ourselves as more than an athlete, more than a performer. And this is from a professional performer, a professional vocalist, and daughter of a professional athlete. So, you know, we're allowed to view ourselves as more than a performer, more than an athlete. And at the same time, as we're doing that, we bring in the brain spotting that allows us to dial down that limbic system so that we can now perform again, and so that we're calm. Our limbic systems are calm around that identity piece too. So both things are happening simultaneously. And it's like you send an athlete back out on the field that's like, you know, and I mean, I don't want to overpromise results, you know, and it's like, and this can happen in 6 sessions for $39.99, you know, like, you're not going to do that. That's not going to be a thing. But I find it to be the most like efficient and effective way to work with stuff like this, you know? So,
I just find this also fascinating. I just think it's so awesome, especially the use cases. Like, you know, there's so much, so many of the people that we see that could benefit so greatly from this, and it just blows my mind. So, I mean, again, if you are listening to this, if you just now jumping in, start from the beginning. Just go back. Just go back. Right. And if you're in there and you happen to hear "Go Dogs" and you're not an SEC person, God bless you. We will pray for you.
We'll forgive you. It's okay. We
we'll
love you anyway.
You know, everybody can't be great.
Unless if you're Bama. If you're Bama, we got a problem. I said, unless you're Bama. If you're Bama, we got a problem. I'm just kidding. I'm kidding. I say, I really am kidding.
Bama folks, we love you. We love y'all. We do.
We do. We love you. I will always still cheer for you, Bama, if you're, you know, playing against somebody that's not SEC. I'm SEC all the way. So there's at least one day of the year, at least, if you've beaten us, that I will cheer for you.
Aren't you excited? Football season is slowly approaching. Go August. Yay. Life in the South. But you know, it's so amazing. If you, like I said, if you're now tuning in, jump back to the beginning. And, you know, again, really, you know, some of the highlights we talked about, you know, what is trauma? We talked about the perception of trauma. And a lot of the time people think of trauma as the big things, like big T. They don't think of layered and nuanced circumstances. They don't think of chronic illness, living with chronic illness, chronic pain. I work with a lot of individuals who have difficulty with intercourse and intimacy. And so they're having pelvic pain, vulvodynia, vaginismus. There might be guys coming in with ED, different things like that. Again, we think about the pain, the discomfort, and then either dissociation, they're like the lack of desire, like I don't want to do this anymore because this hurts. So now I'm completely pulling away. We talked about athletes, and you can kind of start to see this in so many different facets of life. The use for brain spotting, the use for really addressing these things so that people can go back to just living some wholesome lives, and also recognizing that they are more than the trauma. So just such amazing stuff. I mean, I could nerd out with you forever and a day.
I know, right?
Forever and a day. Oh my goodness, just so awesome. But I want to thank you so much just for dropping all that knowledge. Where can people find you? Because now everybody's going to be coming because they got trauma.
Right. We all do. Oh, dear God, do we all? So my practice is petrichor counseling, which petrichor is an interesting word with an interesting definition. And I always feel like I want to drop it with people because people ask me about it all the time. So petrichor is the smell of the first rain after a drought, which I think is so interesting. So petrichor counseling, PETRICHOR. And our website is petrichorecounseling.com. So anybody who wants to find us is welcome to visit us there. Our website is actually about to relaunch. So it was supposed to go up today. We're having a little bit of a technical issue with our domain people, of course.
I love
But
technology.
it will be up, momentarily. So I'm excited for people to see it. Please come visit us. And you can always call our offices. We have a phone number, and we have wonderful office staff that are there to greet people too. Should I say our number? I don't know.
Yeah, go for it. I mean, I'll have all this stuff in the show notes anyway. So,
well,
they're going to call you.
That's fine. I
might
trust
as well
your
tell
notes
them.
more than me.
If you sing the number, they'll remember it.
But I'm afraid that my ADHD will have me getting it wrong. I'll be the one that gets the phone number wrong because I can't remember anything.
You'll be like 77. Wait, what was that again?
Right. That would be me.
Mari, thank you so much for being here. Thank you so much for being a guest with us on the Pelvic Perspective podcast and just sharing. Like I say, we focus on all things between the belly buttons and knees, but that doesn't mean that there's not applications outside of that region, right? So here you go.
Yep.
But thank you so much for dropping that knowledge and just sharing a little bit about more about brain spotting, because I had no idea what it was. And just kind of like letting people recognize that there's hope out there. So we appreciate you, love you as always. So thank you for that. For all of those listening, whether you're watching us on YouTube, catching us on Spotify, definitely leave some comments. Let us know some of the things that you want to continue to see as it relates to all things between the belly button and the knees. But just keep us in the know. Let us know what you want. We are happy to bring that knowledge to you. So until next time.